And it's crazy when people start doing that. You start to believe you're infallible. I've had plenty of people say to me, you're not the right fit for me. Nothing personal, that's fine.
So let's jump back to this hard work thing, because when it comes to social workers, when they're coming out of school, say from graduating, or they've been in practice for a while, you've been in this field long enough that you've been in hospital settings, you've been in private practice settings. What can you tell them? Because one of the things I see a lot with social workers, either interns or just licensed, they jump back and forth because they can either remain in private practice or with the agency.
Here's the thing. I've been with the state now 17 years. And I've had multiple jobs, but I stayed with the state. Where I was working with the kiddie side, now I'm on the adult side. They're an outpatient for the state. I stayed within because I felt it was important, because people look at my resume, there's something for you new graduates also. They look at your resume and they'll say, well, okay, you've worked with the state. Then they automatically, people think this solid. There's stability. And he may have had different positions. They want to see difference in positions. They want to see that. There's growth here. You've done this. You've done that. Fine. But when I read like 10, 12 jobs over a 12-year, 15-year period, I'm like, I don't want to hire this person. They're not going to stay with me.
So would it be good if they're not with the state? Would it be good to stay with a company or somewhere?
Even my private practice work, unless the company, and listen, I've been under companies that went out of business. Living in Las Vegas, I probably like 1, 2, just went under. I'll stay. Mm-hmm. If you look at my resume, I've been with one company like 4 years. Another company, 4 years. I was with another company for like 5 years. They just went out of business. But I stayed. In other words, if the situation is working, why do I need to jump? That's crazy. I've done things besides that, and that's something but the creativity part of mental health is I've done work because, again, getting out there, shaking the hands. This is for new people as well. You shake hands. I've met attorneys. Yes. I've met judges. I've done youth justice people, parole, youth parole, youth probation, adult probation. Hey, I'm available to do this. I can do this. I can handle this. And people get to know you, and they begin to respect what you bring to the table because you have an expertise. You bring the work in on time. It makes sense. You're willing to go above and beyond. Oh, you need me to do it by Tuesday night? Okay, I'll make it happen. You need to report by next Wednesday? I'll make it happen. And people appreciate that and they respect that. A lot of social workers have no clue about deadlines. It's like, I need this report for our quarterly review. Yeah, I'll get to it, maybe not. Yeah, and then you're screwed. You got to have the ability to say, like, what can I bring to the table? And what are people's needs going to be? So when you go into a room, like, I'm here to help. I'm here to help. Not defensive. What can I do for you? What do you need?
Now, let me ask you this, because with social workers, I always use the terminology, it's kind of funny, it's like herding cats. Because they're very individual people. So even if an agency or state or anything, like you just hit, when they look at it, I'm here just to do therapy, and they're not part of the culture, it's really hard to get them into the culture to say, if it's for the state, you're a team, you work for each other, you support each other. You have people under you in your current position. Even as a small agency, it's really hard to get them to buy into the culture because they're all about themselves at times. And it's hard because we're teaching the ironic thing in therapy or in treatment, you're teaching individuals to be a part of a system. Isn't that kind of an oxymoron?
It makes no sense to me. It's crazy to me. Like, I'm telling someone who's depressed, join a gym.
And you don't do it.
Start walking. Meet people. Go hiking with the club. Blah 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 blah. Be active. If you start to shower and you work out, you feel better about yourself. Blah blah blah. We all get this. Uh-huh. Yet, for many therapists, including social workers, psychologists are a different breed. But anyone else, it's like you say to them, like, I represent this company. So I've done things as clinical director, not to say anything amazing for companies, where, quote, quote, it wasn't, quote, quote, my job, but I did it because it benefited the company. So they'll say things like, Bruce, can you do what they call a peer-to-peer, which is not fun, but you got to talk to an insurance company because they're trying to salvage some services for a client. Well, a lot of times it wasn't even my client. email me it, let me read it, I'll do the call for you. No problem. I'm here to help. A lot of times today, you don't even get what you're asking for. You get a fraction of what you're asking for, but at least Matt has a feeling of Bruce made the effort.
He's on the team.
Bruce cared. Like, he cared enough to say, "Oh, it's not your kid." He's willing to help. "Hey, Bruce, we're having like a speaking engagement. I'd like to get you there for half an hour. Talk about what you do. Talk about my agency. Promote it. Blah blah blah." I've done hundreds of those kinds of things because if Matt gets more business, indirectly can only help me. And he has a bottom line. He has to make profit. He has to make money. So if I'm not helping out, like, okay, he got 4 referrals where someone said, "Hey, Matt, you know what? I'd like to use Bruce in a different capacity as a speaker. Does your agency supply that?" Helping out Matt. Helping to say, here's what they provide. And you'd be amazed how people appreciate that. I've had sit-downs with agencies and this and that. "What can I do for you? Can you help us with this? Can you help us?" Yes, 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 yes. Because if I benefit, they're going to benefit, and vice versa.
It becomes that win-win.
Win-win. But so many social workers and therapists in general, like, no, black ops, I don't have to share, I'm going to do it my own. It's stupid to me. So many times I said, okay, you know what, I can't do it, let me pass it along to this agency. I've even done things where I'll say to Matt, "How can I help you?" Oh, he said, "Can you do me a favor in a certain area?" If I can help you, I will. Because if he's successful, that means his marriage is going to be successful, make his wife happy.
Happy wife.
Happy wife, yeah. Why not? And it's amazing to me that people don't look at that. Even if I see alternative avenues to make money, this is a business. Do not kid yourself. This is a business. Yeah. So if I can look at an alternative avenue, "Hey, Matt, check into this. Matt, this might be something that you might be up your alley. Help him make money. Help him be successful." Believe me, people think like this.
The ironic thing, to kind of bring it to conclusion, I always try to simplify it for the providers. To become a rockstar provider, you have to understand both sides, treatment and business. Because if you don't, you will always be in that social worker gap of making $60,000 a year, and you'll be stuck. And they don't understand is this business is like the best way to simplify it. Maybe this helps is if I'm a general contractor and I build houses, I'm going to have subcontractors come in and do the foundation work, the framing. It's the same concept as a business owner. We own, as we know in our state, it's called a provider 14 or a hospital. It doesn't matter where you're at. You're still a subcontractor. One might give you more of a fuzzy, warm feeling and pay you hourly. You might have that paycheck that feels good. But at the end of the day, they can fire you, let you go. Because like if you said hard work, if you're not a consistent worker, even the hospitals, even the paychecks will say, "Hey, Bruce, it's just not working out. We got to let you go." Because we see it as an owner and as a business leader, but as trying to work to become that rockstar provider, I can spot a provider in a heartbeat and know if they're passionate about what they're doing. It reflects in their paperwork. It reflects in their attitude when they show up. It reflects how they, like, I like how you use black ops, because you can tell if they have hidden agendas. They also, in the community, being such a small community, I don't know if you notice this, again, we're in treatment trying to teach people how to have psychosocial skills, but as providers, when something goes wrong, we're the first ones that they start causing rumors among each other, which I've had to reach out and squash a few of them because of emotional, I call it maturity. And I don't, it's kind of dangerous. I don't know what your thoughts on this. If you're that type of treatment provider, you need to not be in this industry.
You got to look at it from in any profession.
Yeah.
Nothing is beneath me. Nothing.
Nothing, yeah, I agree with that.
Nothing is beneath me. I'm not. I've had people call me up and say things like, "Bruce, you got to do this, you got to do this." I've had people get upset, angry. It's not beneath me. It's not beneath me. And you got to understand that when you're working. And you got to understand that.
So the last part of this interview on the Provider Channel, I wanted you to just leave with them on how can they become rockstar providers by not burning themselves out, being a part of the team, and grow themselves. What would you give them as advice?
Oh, no problem. As far as burning yourselves out, which is so common in this field because people internalize so much, don't. People are mentally ill for a reason. They've had therapists before you. They'll probably have therapists after you. Don't personalize it. Do the best you can and then let it go and move on. I tell my people all the time, you're sick, stay home. You don't always need oodles of overtime. You know, you got vacation coming up, enjoy, have fun. Spend time with your family, spend time with your kids. Have a hobby. Don't make this your life. Also, please, 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 stay away. The old days was called a water cooler. Stay away from the rumor mill. It's not your job. Just do your work. All I want is for you to do, I hear this so many times, I could show Mac and echo this, just do your work and go home. I don't care about my coworkers' personal lives unless they tell me about it and they want my opinion. Other than that, I don't care. I got my own issues to worry about. Let that be. Be a part of a team and realize the grass is not always greener on the other side. Talk to your boss. What I do with my people now is I say to them, what are you looking to do? What do you want to get into? I mean, Matt is a creative guy, for instance. If you say to him, I'd like to get into public speaking, or I'd like to do stuff online. Most social workers are so inept in trying to decide what they want to get into, they get angry, they get frustrated, they get bitter. What have I done with my people lately? I put one person in charge of a program for reentry for prisoners. I put another person in charge of starting an NAAA spirituality program, bringing people from the outside. I got one person doing trainings for correctional officers. I assigned a couple of people to a project about another facility. They would be the point people to finding out the information behind it, what's going on with that. I even appointed one person, a person that we both know, a training coordinator for interns coming out of, in college that need their practical experience, blah, 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 in grad school. Giving them a chance to grow. To grow. I made them block captains to give them administrative experience. So they're in charge of 5, 6 people. So they can take care of stuff that doesn't always have to come to me. They can deal with it. But giving people a chance to grow in different directions. And I say to them, if you show me stability, I can use you. Last thing is, be creative. The reason why I'm sitting here doing this thing with Matt is because I've always talked to Matt about my desire to be as creative as possible and push the envelope. And Matt, to his credit, has always been a big supporter of that. And that's why we're actually doing this kind of channel, is to get our name out there, be creative, look at new mediums. The old days of this one-on-one therapy, it's coming to an end. It doesn't make sense. So you have to be different in how you approach the medium, be profitable, make money, make it into a viable business, but at the same time grow. I'm not the same social worker I was 20 years ago because things have changed. Things I didn't even know even existed are now a factor today. Traumatic brain injury, synthetic drugs, the effects of fetal alcohol syndrome. I wasn't aware of this stuff when I was going to grad school, but boy, am I aware of it now. Trauma in infants, didn't have a clue. Went to class, studied, listened, learned. You don't always have to show people how smart you're not. Listen, open up your head, quiet, just listen, learn, talk to people, introduce yourself. That's how you become relevant and indispensable and ultimately a content provider.
So there you have it. Thank you so much for being on the channel today. And I wanted to bring to you on the value 6, hard worker, what that means to be a hard worker. Some of us always think, well, just does it mean to go to work and just kind of provide a shoddy work? We talked about that a little today, is actually provide quality work, not quantity, because quality will always make up for quantity, right? Because if your quality work is really great, if you put your mind to it, be creative, stretch out there, become rock stars, continue to be who you are, grow yourself, grow those around you, your team, and grow your profits, as we've always mentioned. All right, guys, continue to be rock stars out there. Remember to never give up on yourself and those around you. If you need anything, go below and push subscribe. Check out Bruce's stuff also. He has a channel as well. Make sure that you're always providing good content. Until next time, take care.